Prior to Spinraza, this was a devastating disease that with a lot of mortality. So type 1 SMA, which is half the SMA patients' cases, they typically died before 1 or 2 years of age, and if they didn't die, they needed permanent ventilation and they were paralyzed. So really terrible prospects.
A lot of the parents, when they got a diagnosis of spinal muscular atrophy, they were told to go back home and love your child and spend as much time with them as you can because, their life expectancy was less than 2 years.
Asher was born healthy. He was born at home. He was 9 pounds, 5 ounces. No family history of any issues. We had never gotten genetic testing, never even thought about getting genetic testing. And then around 4 months old, I felt like something seemed off with him as an infant. We ended up just having a random pediatrician appointment for our oldest daughter. The doctor was concerned about something called hypotonia. So when we learned about hypotonia, we learned that Asher had some muscle weakness, and then that led to getting him tested. A month later, we went back to the pediatrician and he sent us to a neurologist. And then that's when kind of everything started for us. We found out that Asher's test for spinal muscular atrophy came back abnormal, and at the time we had no idea what that was. The neurologist didn't even have an answer for us. He literally handed us a Wikipedia page and told us that that was all the information that his office had on spinal muscular atrophy, and that the prognosis was to just take him home and love him, and he wouldn't survive until his second birthday.
The day of his diagnosis, the official diagnosis day, we got a call from Dr. Richard Finkel at Nemours Children's Hospital about the potential for this clinical trial for a drug. At the time, it was letters and numbers.
Yeah, that's true.
Then it was called nusinersen, eventually approved by the FDA under the moniker of Spinraza.
Spinraza is a type of drug called an antisense oligonucleotide, or ASO. So it's a short strand of nucleic acid like DNA or RNA, and it has a defined sequence of building blocks or nucleotides. And that sequence directs it to bind to a particular RNA in the cell at a particular position of that RNA. So the bottom line is that the drug allows the SMN2 gene to express higher amounts of a protein that's critical for the health of motor neurons.
Spinraza was the first to really show that SMA is a treatable disease.
By the time he was first dosed, he had lost pretty much all movement. 3 doses in, he really started to wiggle some and lift a leg. The first sign that we thought something was working was he would lift, when we were changing a diaper, he'd lift his leg straight up in the air.
The original partnership with Cold Spring Harbor was focused on a technology that they had published on, and we decided to collaborate to advance that technology towards patients. It turned out that that particular technology didn't work out, but the collaboration worked out, and so we found an alternative path to find a drug, and that ultimately became Spinraza.
Well, in my lab, we were doing the science, and so we had little idea of how to take these developments and turn them into a therapy or a drug, an approved drug. So the TTO was essential in setting up the partnerships with industry.
Well, at Cold Spring Harbor Laboratory, we're a smaller institution. We have 55 faculty, and we don't rely on a disclosure process. We actually work with our faculty from the day they arrive as a brand new scientist at Cold Spring Harbor Labs, and we talk to them about what their aspirations are for commercialization of ideas. So it's a little bit different, and so we follow and track those ideas as part of rather than a disclosure, we talk about goals that they have on commercialization, and we follow that process to the commercial outcomes. It might take 2 or 3 years, but we still get there.
Now, thanks to this treatment, more than 15,000 patients, maybe going closer to 20,000 have been treated, and so they live longer, they have better quality of life, In particular, patients can now be diagnosed very early and start the treatment when they're just a few days of age. Then they don't even get the disease, so that's practically a miracle in my mind.
We get to experience a lot of firsts with him that a lot of families before us didn't, even passing that second birthday.